At-home COVID tests are a hot ticket item. Major retailers like CVS and Walgreens can't keep them on their shelves.
Right now, we're limiting just one test per person.
And testing sites are no different. Every day, hundreds of cars line up waiting for an appointment.
I can tell you that we have been busier than we've ever been. We've been conducting about 500 tests each day.
Monica Hiltz with Fisher's Health Department says when a test is done through a health department or pharmacy, those results are reported to the state. But when someone does a test at home, it usually never gets reported.
You're responsible for reporting it yourself, and most people don't do that.
Some states have started online forums or websites for people to submit positive results. But right now, Indiana doesn't have anything set up, saying in a statement, even if results were reported, there is no way to confirm that each test was performed correctly and provided an accurate result. That means COVID cases are likely higher than what's being reported, especially after the recent demand for rapid tests around the holidays.
That will probably skew our numbers a little bit here, both this week and into next week.
And since there is no way to self-report, Dr. Brian Dixon says it can help when people get a follow-up test in person.
If you go in to get a PCR test as a follow-up to that at-home antigen test, at that point, if you're positive, it will be reported to the state health department.
As home tests continue to gain popularity, health departments are still encouraging quick results, but are also rethinking how they measure the virus.
The more that COVID becomes endemic and the more accessible these home tests are, the more we're going to have to use them extrapolating to guess at the true burden of infections.
At-home antigen tests might not be great at detecting the Omicron variant. The FDA says the tests can still detect the new strain, but they're less sensitive to it. That's because antigen tests work best when someone is most contagious, and Omicron has milder symptoms.
So that may be another reason to select the PCR test. Most of the labs are turning those around within a day or two.
If you have symptoms and get a negative home test, it's a good idea to test yourself once again a day or two later just to be sure. IU Health is asking you not to get tested at any of its hospital emergency rooms. Doctors say at this point they've got to leave as much room as possible, not just for serious COVID patients, but anyone with serious injuries or illness. Instead, if you're having mild symptoms, you can visit IU Health's virtual visits app or call an urgent care clinic or community site to get tested. We've got a link to those locations at WTHR.com/coronavirus. The FDA is looking to expand booster eligibility to children ages 12 to 15. This would only be for the Pfizer booster shot. It's expected to be announced by next week. The news of the pending approval comes as the Omicron variant is spreading fast across the U.S. Right now, the CDC says Omicron accounts for about 58% of all new COVID cases.